Hello and welcome. You're watching our show Fighting COVID with Dr. Guleria. We'll be taking all your questions as well. I'm Sonal Mehrotra Kapoor. But let's first start by telling you what exactly has been the update this week. Now, India's COVID graph continued to show an upward trend as the country reported 44,230 new cases on Friday, the most in 3 weeks, amid fears of another wave of infections. Now, the spread of the disease, which had eased off after the peak of 4 lakh daily cases in May, has forced at least one state to lock down, while movement restrictions are in place in some other northeastern states, reporting a rise as well. The issue here at the moment and the concern is the R factor, the factor which indicates the speed at which COVID-19 infection is spreading in the country. That has inched up to in the past week, with Kerala and northeastern states reporting a steady rise in cases as well. Overall, India is just at about 1. Kerala, meanwhile, has reported over 22,000 cases for 3 days now and accounts for more than 37%, in fact much more on certain days, to the active cases. The southern states continue to have a R value which is just around 1.11 as well. So how worrying is this? And if this trend continues, is a third wave inevitable? Joining us tonight is, as always, Dr. Randeep Guleria. Thank you so much for your time, Doctor. Just want to start by asking you, how worrying is the current R factor overall for India and then for the southern and northeastern states as well?
So it is a cause of concern because, as you have rightly said, R naught has gradually been creeping up, starting from 0.96 going all the way up to 1. And this is a cause of concern because this means that the chance of infecting others from an infected individual have gradually gone up, and you will see an increase in number of cases because if the R naught increases, the number of people one person can infect starts becoming more, and then it has a cascading effect. Therefore, it's very important that in areas where the R naught is going up, we have an aggressive action. The Government of India already had put that in place many weeks ago in terms of limited lockdown, containment strategy, very aggressive surveillance, testing, tracking, treating, and making sure that we don't allow the cases to go out of control in that area, and also that it doesn't spread from one area to the other. So I think in those districts where the R naught is going up, we need to act early rather than late so that we don't allow the situation to go out of hand.
Right. And Dr. Guleria, would you say that R factor overall in the country and also in specific states is the one thing that tells you or gives you a sign of the onset of a COVID wave? Would that be a correct way of looking at it?
So it's one of the factors. As a matter of fact, R naught is not the correct word to use. We can use what is known as RE, or the efficacy, because R naught is used predominantly when we're talking of individuals who have not been vaccinated. Now we have a population which is susceptible, but part of them have also been vaccinated and therefore are protected to some extent. And therefore we need to look at that in a true context. Secondly, the important issue is also to look at the positivity rate and also the number of people being admitted into hospital with COVID infection, and whether that is rising or not. That will give a comprehensive picture of how serious the problem is, because we may have situation where you may have the R naught still being borderline, but a large number of people getting sick and coming into hospital, and that also needs to be factored in.
That needs to be factored in. All right. I want to now, Dr. Guleria, look at separate parts of the country and how they are behaving. I want to start with Kerala. More than 50% of the cases at the moment in the country are coming from Kerala alone. And we've tried very hard to understand what exactly is the Kerala story. Why do we keep getting more and more cases from Kerala? A state which is testing high, yes. A state which is vaccinating in good numbers as well. That's also true. So have there been teams sent? We know so far the centre did send out a team to try and understand what exactly was the reason. Do you have some insight into why Kerala remains to be such a huge concern?
So I don't have any insight. We can speculate, and I think there are a number of factors. You're right that Kerala is a sort of a cause of concern, because despite the fact that it did very well, there was the issue of the Kerala story in the beginning of the pandemic, how well they managed the pandemic, and also the fact that the number of cases was less there, the very aggressive vaccination drive. Yet despite that, the number of cases there have not come down and they continue to increase. and it's different from how the rest of the country is behaving. So there is a need to evaluate that. Is it related to the fact that you still have a larger susceptible population there? Also, is there some new variant which is developing out there, and therefore there is a need to aggressively test to see whether there is some thing happening there in terms of the virus per se. And of course, whether the strategies that we have just mentioned in terms of containment, testing, tracking, tracing, and isolation are aggressively being monitored. But I think it's a cause of concern because remember, we've always seen that this is a moving pandemic. It starts from one area, and then when the cases start increasing there, it gradually then spreads to other areas. The last peak that we saw started from Maharashtra and the western part of India, and then gradually moved to central India and then eastern and southern India. So in any state where the cases are not coming down or showing a rising trend, one needs to address it aggressively, because then this may be the beginning of cause of concern as far as the pandemic is concerned.
Right. And Dr. Guleria, what's fascinating here and perhaps troubling here is the fact that it's not just Kerala, it's now the neighboring states as well. It's states like Tamil Nadu, Karnataka, amongst the 10 states which have seen a rise in these cases. Would you recommend aggressive testing, or like you're saying, more specific genome sequencing being done in these states to try and understand what is the factor leading to such rise?
Correct, because these are neighboring states, and therefore there is a lot of movement of people from one state to the other, and we know that as people move, they will also carry the virus with them. And therefore, if we have a virus which is slightly different, it may start causing more infection, and that is why, from both the point of view of how the virus is behaving and how the host is behaving, we need to start testing to see that we're not missing out on anything. But at the same time, the strategies that we have in place, that is in terms of containment, in terms of testing, tracking, tracing, in terms of having containment zones and surveillance, need to be put in place so that we are able to contain it early rather than late.
Right. Dr. Guleria, I just want to shift our focus to Tamil Nadu now, and another fascinating story coming from there. Tamil Nadu is a state in which a recent Sero survey actually pointed that 66% of the population had COVID antibodies. Yet it is one of the states which is giving you such high numbers. So my question is, how dependable really are these Sero surveys that we get from these individual states, and how much can we bank on them?
So Sero surveys give a rough idea, but they are not something which should tell you that this area has got herd immunity. And we realized that long time back from what came out from Brazil. In Brazil, we had the city of Manas, which had Sero surveys saying that more than 70% of the population was vaccinated. Yet, we had a huge outbreak of COVID-19 there, with a large number of people having lost their life or going into hospital. So one thing that we need to keep in mind is that we really don't know what is the cutoff in terms of the Sero positivity to say that you are protected. And this is a one-time test. So your antibody titer may gradually decrease over a period of time, and therefore the degree of protection is not very clear in terms of the Sero survey data. It does give us some idea that yes, a large number of people have got the disease in that area, and therefore chances of serious infection may be less. You see, it's another important thing to look at Kerala for that matter. Although the cases have risen significantly, we have not seen a similar rise in the number of deaths or the number of hospitalization. And this is also what we saw as far as UK was concerned. UK is seeing a surge in the number of cases. But the cases have not really reflected in, this is not reflected in the number of hospital admissions or number of deaths. So currently the graphs have actually changed as compared to the second wave, where the cases graph and the hospitalization graph and the death graph are rising in a similar manner.
Right.
So to some extent, the vaccine has helped us out here, and it has actually prevented serious illness. So people are getting the infection, they're spreading the infection, but they're not getting serious disease, which is a positive sign.
Right. So another example really for people to understand, or anybody who's still hesitant about getting the vaccine, to go out and just get your jab. That is the need of the hour right now. Let's talk about the other part of the country now, Dr. Guleria. We're looking at cases rising at a very high percentage, not in absolute numbers right now, but the percentage of rise in these states like Himachal Pradesh, Uttarakhand, etc. is really high. Would you say this then tells us, and there is a direct link to tourism that we saw in those states in the past 1 month or so?
Yes, so I think, like we've been saying, that the pandemic is not over, and we need to prevent events which can be super spreading events. We need to really aggressively follow COVID appropriate behavior. And if you have an event which is a super spreading event, the effect of that usually occurs 2 to 3 weeks later, because that is the usual incubation period and the cases will rise later on. So that is why one is still concerned about the non-essential travel that happens in terms of tourism, in terms of other activities. And I would still appeal to everyone that our cases are not down, the pandemic is not over. Therefore, please follow COVID appropriate behavior. Don't allow events which can be super spreading events to happen. And especially when we look at tourism, where we have huge number of people gathering in certain tourist spots without wearing masks, forming crowds. One person out there who's infectious can spread the infection to a large number of people, and they will then carry that infection to other areas and give it to the locals in that area also. And that is what is happening in different parts of the country.
Right. Well, to our viewers, I can just say this right now, that Dr. Guleria for over a year has been repeating this. We on the channel has been repeating this again and again. And we really, really hope that people now, at least from these very clear examples of how cases spike the minute you see unrequired travel and non-essential travel go up, is an eye-opener, if not already. On that note, we're going to slip into a break. On the other side, we'll have some questions about the vaccines. And Dr. Guleria stays with us on that. Welcome back, and we continue to be in conversation with the Dr. Guleria, who's very patiently been taking all your questions as well. Dr. Guleria, I want to move on to vaccines next, and one concern on that front has been COVAXIN actually falling short of its supply targets. Now, this has meant that the overall expectation of the number of vaccines the country was expecting and the number of jabs we were expecting to put in people has also gone down. How big an impact do you think is going to have on our targets?
I don't think it will have a big impact, because the production is picking up, and I'm sure that it will pick up, and we will be able to sort of meet our targets in the coming few weeks. Also, multiple other vaccines should also come in. The Zydus vaccine has also applied for emergency use authorization. Therefore, I am quite confident that in the coming weeks and months, we will be able to meet our target. I would just encourage everyone who is eligible to get himself or herself vaccinated to register on the app and try and come forward to get yourself vaccinated, so that more and more people get vaccinated in the shortest period of time. The initial sort of eagerness to get vaccinated seems to have waned a little bit, and therefore I would really encourage people to look at this as something that can be life-saving, because like I just mentioned, vaccines will prevent you from getting serious illness. Therefore, come forward and take your vaccine and use the app to book your date.
Right. But Dr. Guleria, are you saying that the loss in sort of enthusiasm to get the vaccines could also be related to the number of cases being low right now? And people think that what's the need of a vaccine when anyways the numbers are so low?
So that is what happens. You know, there is a little bit of a sort of a feeling that now maybe we don't need to get ourselves vaccinated because cases are so low, or the sero survey is showing that 60% of people have got antibodies, so maybe now we don't need to worry about it. I'm just trying to tell people that that is not the case. The pandemic is still there, still on, and we need to really get ourselves vaccinated, because vaccine is the only way that we will come out of this pandemic, and therefore we need to aggressively move towards everyone coming forward and taking the jab, because that's very, very important.
Right. You talked about Zydus Cadila over there, a very fascinating tech that this vaccine actually has. It's a patch. It almost attaches to your body like a band-aid, and you can remove it later. There is no injection. It's also available for kids. But we've seen some sort of a delay over here. It's been almost a month that we saw them submit their report to the controller, and we still haven't heard. Do you have some insight on what's the cause of that delay and how soon we can expect it in the market?
So I don't have any insight, because I'm not a member of the committee which looks at it, but it's likely that the experts have wanted a lot of conclusive data in terms of safety and efficacy. Remember, this is a unique vaccine. It's something which is being developed in India and being done for the first time in the world. It's a DNA vaccine, and like you rightly said, it doesn't really have an injection. And therefore, the technology is new. The platform is new, and therefore all the experts would want to be really confident that this is a safe and effective vaccine. And I think it's very important that everyone has convinced himself that this is safe and effective before it is then given emergency use authorization. Because then once it gets rolled out, then it will be given to a large number of people. And that is safety and efficacy is paramount.
Right. I just want to move, as we head into the last leg of this conversation, Dr. Guleria, towards the world situation on COVID right now. We're looking at some fascinating details coming in from Israel, where they have said that a third jab will now be given to those over 60. We are talking at a time when the United States, at the same time, is also looking at expanding, though they're saying they're not going to look for a third dose just yet, but they're waiting for more evidence over here. What does this tell us about the virus?
So I think there are 2 or 3 things that I'd like to say here. One is that there is really not evidence right now to suggest that we need to take the third or the booster dose so quickly, and we need more evidence to say that this is effective. The second important thing is that we still have a large number of people in the world who haven't even got the first jab. I mean, if you look at Africa, the whole continent, only 2% of the population is vaccinated. And therefore, it seems rather unfair that people are taking a third jab with very little data to support it when many people in the world have not even got their first jab. And the reason why I feel it is important is because no one is safe until everyone is safe. Remember, this pandemic, if you have a new the pandemic going along in one part of the world, new variants will develop in that part of the world because of the fact that the virus continues to replicate that. And these variants will spread to other parts where people have been vaccinated, and the vaccine efficacy may become less because of immune escape mechanism. Therefore, I think it's very important that people look at it from a global point of view and try and really encourage everyone to get vaccine or make vaccine available for the entire global community, rather than having vaccine nationalism and giving your own citizen 3, 4 jabs with very little data, whereas others are not even getting 1 jab. So I think we need to look at it in a more holistic manner.
Right. Something that the WHO has also echoed in their COVAX program as well, saying that there should be equal distribution of vaccines across the globe, and that is going to be the way forward. Interestingly, Dr. Guleria, in China, however, we've also seen where the first virus was actually, we've seen a massive spike in cases just in the past couple of weeks as well. What do you think is happening there?
So that's exactly the point. In China, what happened was, what they're saying is that a passenger who I think traveled from Russia was carrying the new variant, most likely the Delta variant, and this led to the infection spreading in that area. Now they're seeing a huge surge in the number of cases, despite many people having got vaccinated out there with the Chinese vaccine. So unless you have people across the world who are vaccinated and are protected, people will travel and will sort of go through whatever system of barriers you have, and this will lead to the infection spreading to other areas, and that is something that we need to worry about. The Delta variant has now become the dominant variant globally.
Yes.
It has spread across the world, and that shows how infectious this virus can become and how quickly it can spread from one part of the globe to the other. And that is something we need to keep in mind when we start looking at vaccinating only a limited number of people in one area and leaving the others vulnerable in another area.
Right. I'm very glad you brought in that issue about the Delta variant, which brings me to the next question really about what the CDC has actually said about the Delta variant. They said the Delta variant may spread like chicken pox as well. So a lot of undertones to what exactly they meant by it. Could you explain that on an Indian context here?
So when we're talking of, when we started this thing, we talked of the R0. The R0 means how quickly the infection can spread, and we were worried that if the R0 crosses 1, it is a serious concern. Viruses which have, like chickenpox or even for that matter measles, have an R0 which could be 8 or more. That means one person can quickly infect 8 individuals rather than just one person infecting 1 or 2 individuals. And that really sort of suggests that this virus is highly infectious. It spreads very, very rapidly, and if anyone comes in contact, he will get the infection. We saw that in our second wave, where there's this huge surge in the number of cases which really went out of control because it was not one or two members in the family, but whole families were getting infected because this virus was so infectious. And this happens with chickenpox also. When you have children if one child has chickenpox in let's say in a classroom, then all the other children also get exposed and they get the infection. In a similar manner, if one person in the family has the Delta variant and others are susceptible, almost everyone will get exposed and get the infection.
Right. All right, Dr. Guleria, we'll leave it there for the moment. Thank you so much for your time. Thank you so much for educating it and putting it out so simply for our people and our viewers to understand. And we really hope they're listening into this very, very carefully. Thank you so much for your time.
Thank you.